Hello there, I'm Mark Allen, Managing Director of COLTENE UK and Ireland, and I'd like to thank you for purchasing the BRILLIANT Componeer kit. What we're going to do today is I'm going to show you briefly the contents of the kit and run through each part, and then I'm going to hand you over to Dr. Chris Siddons, who will go through the actual technique that you would use on a patient. So you will have received your kit from the dealer, which is actually inside a tin for storing all the contents, and inside the kit, when you open it, you'll find a step-by-step guide from Dr. Mario Besek, who was the inventor of the Componeer system along with COLTENE. And then inside the kit you have everything you need to do for the patient treatment. So we have the size guides, which are small, medium and large in the uppers and medium and small in the lowers. We also do extra large, so that if you have a case where you need larger veneers, you can measure the patient too. Composite is supplied from BRILLIANT EverGlow, which is the same material as the veneers are made from, and you actually get two shades in the kit of the translucency, the same as the veneers are made from. So if you ever need to do any adjustments or repairs to the veneers, you have the composite with you. The 1-coat-7 universal bond for preparing the veneer fitting surface and for bonding to the tooth. Then the instruments in the kit are the carver, which allows you to trim off all the excess composite before you light cure. Very useful instrument. Then you have the placer instrument, which allows you to pat the composite onto the fitting surface of the veneer and then slide the veneer into position on the tooth. You have the acid etch for the total etch technique for preparing the enamel surface. You have some silicone polishers for adjustments after, and then you also have in the kit two of the actual veneers in the two translucencies, so that you can show the patient the exact quality of the veneer and also for you to do some trial shade matches. The actual veneers are laid out in the box as a 3:3, and you have medium and large in the two translucencies, which are the most popular sizes. Other sizes are available separately. The actual veneers are individually packed, and they have on them the reference and the size, so that you know exactly what veneer you used and which one to reorder to restock the kit. You also get some premolars in the kit, so if you're doing a wider smile where you need the fours covering, then you can have those to use as well. So you will have received from COLTENE your Componeer tutorial box, and inside there is everything you need to run through the technique with Chris. So you open the course box, and you'll find the model you're going to be working on, which has got a central and a lateral tooth prepared, the size guide for measuring the tooth, the actual veneers, the central and the lateral, the 1-coat-7 universal bond, the carver instrument and the placer instrument, some composite in shade A1 and bleach for you to use to cement the veneer, some polishers, which is a shape guard, so pre-polisher and a gloss, and then some discs to adjust the shape of the veneer around the cervical margins. Finally, we have a burr kit from Dr. Mario Besek, and this contains the veneers prepping burrs, which are the ideal sizes. Plus, we have some polishing burrs, including an ultra-fine diamond for polishing around the cervical margin of the Componeer afterwards.
Hi, I'm Chris Siddons. I'm an implant, general and cosmetic dentist from a private practice in West Yorkshire. I've been using the Componeer system since its initial launch back in 2011. In this video, I'm going to share the technique that I've adopted for the Componeer system over the years and share with you some tips to help you get started offering the Componeer as part of your everyday clinical practice. Welcome to the training video on Componeer. So what is Componeer? Componeer is an adaptable, preformed, transparent enamel layer of a multi-layered or natural layered restoration. It's best not to think of them as the same as porcelain veneers, but more of the enamel layer of a layered composite. They're made from a highly filled nano hybrid composite with sub-micron particles, and they have a micro-retentive inner surface. They're around about 0.3 of a millimetre in thickness, which ticks all the boxes for minimally invasive dentistry. They're currently available in two shades, bleach transparent and transparent, and they are made in multiple sizes that just about will fit every tooth that you're likely to restore. Before starting a case, two things really need to be considered. The first of which is whether orthodontic treatment alone may be appropriate to create your patient's smile. It may be that you require orthodontics to position the teeth in a much better position for us to enable to do more minimally invasive dentistry, i.e. if possible, if we can do zero or minimal preparation for the Componeers. Ideally, Componeer preparation it should be minimal. It's better if the minimal amount of enamel is removed. The other thing to consider is whether a whitening would be appropriate for the patient as well. If we're going to go down the whitening route, this really needs to be completed 2 weeks prior before Componeer treatment. Reason being is that the whitening can affect bonding strengths, which has been proven, and also to allow for a bit of drop back of the shade and rehydration of the enamel. So the first thing to do is select the enamel shade. There are only two shades obviously with the Componeer at this stage. There is a bleach translucent and a translucent. So this is selected when looking where the enamels are thickest, which is obviously on the incisal edge of the tooth. In this case you can see this is a more elderly patient who didn't want to whiten the teeth. So in this case we would select the translucent Componeer shade. As in nature, the Componeer or enamel layer of the tooth is almost transparent, so the colour of the final restoration is more or less going to come from the dentine or the luting layer. One thing to bear in mind is that the luting layer, the dentine composite, must be a minimal of 0.25 of a millimetre thickness. This is to stop a greying out effect due to the translucency of the Componeer or enamel layer. This is common under all multi-layered composites these days. To err on the side of caution, I would always tend to use a slightly lighter dentine shade to overcome the greying out effect. Certainly if you're unsure about the shade of the dentine composite. You can use any composite as a luting composite, but COLTENE do recommend that you use BRILLIANT EverGlow to produce a homogeneous final restoration, all made of the same material. The dentine shade or luting shade can be selected from the wide range of colours in the BRILLIANT EverGlow composite, which also offers some duo shades, and all shades have a chameleon effect to help create really natural looking restorations. The dentine shade is selected when looking at the tooth in natural light if possible, and studying the tooth looking at the cervical part and the body of the tooth. The shade can be checked by curing unbonded luting composite onto the tooth at a thickness of a minimum of 0.25 of a millimetre and light curing. Then by placing a Componeer on top of this, it should be possible to check the shade. It may be that a more natural polychromatic effect is chosen if perhaps the cervical part of the natural tooth is darker than the body shade, in which case 2 or more dentin shades may be chosen. For example, you may choose something like A3 around the cervical area, which will blend into A2 or A1 shades in the body of the tooth. While studying the tooth or teeth at this stage, it should also be noted whether or not there are any marks or mottling or infractions, and taking note of things like mamelons, incisal edge wear, and any tertiary anatomy. The Componeer can be characterized to show these, and it helps to create really great natural looking restorations. It's particularly important if you're using Componeer to restore 1 or 2 anterior teeth, and in which case it may be important to copy the anatomy of the opposing natural teeth. We will come on to the characterization of the Componeer at a later part of this video. In order to select the right size of Componeer, I would suggest these are first done on a study model. To choose the correct size Componeer, we use the templates that are provided within the kit. Componeers are available in small, medium and large, and extra large. They're available to restore from 5 to 5 on the upper arch and the lower arch. The most commonly used sizes are in the kit that you've purchased. If you are struggling and you require a different size, I would recommend you contact your local COLTENE representative to help you choose the right size, which are available to buy separately. You use the template to select the correct size Componeer, and this is chosen by its best cervical margin adaptational fit, and also interdental width, and also by the length. It's best to try and get the best possible fitting Componeer and go right through the templates until you find the one that's the most adapted to the tooth that you're going to restore. This may mean using a lower Componeer to restore an upper anterior tooth. Remember, it may be that you want a longer length Componeer if you're going to restore attrition on a tooth. And it's also, as a best rule of thumb, if you're unsure, to always go for a slightly larger Componeer and to reduce this in size. Using the template on the study model will also give you some idea of the position of the Componeer, and also give you some idea about how much adjustment you may need to make to create the space for the Componeer to be placed. It gives you an idea of spatial position and how much adjustment you're going to need to make to the Componeer to fit perfectly. With regard to the training session, the Componeer should fit almost perfectly, but it is a good idea to get used to doing some minimal adjustment. This can be done very gently using a medium grit polishing disc and holding the Componeer in tweezers or in gloved fingers. Just do this very, very gently with very minimal adjustments, and keep checking the Componeer against the study model to make sure you've not removed too much of an excess of the composite. When you've done this and you're happy with the fit of the Componeer, it's a good idea to then use an ultra-fine polishing disc and polish all the areas around the Componeer that you've adjusted. The amount of tooth preparation for Componeer should be kept to a minimum, especially as we're trying to practice minimally invasive dentistry. The template gives a good indication of the amount of preparation required and where the preparation needs to be on the tooth to allow a minimum of 0.25 of a millimetre of the lutein composite when the Componeer is in the correct position. Any preparation should only be in enamel, and this can be done with the veneer preparation burr within the BSEC burr kit. I often will only do a minimal finishing line at the gingival level with a small round diamond burr, and enough space needs to be created between the teeth such as acetate strips can be placed or PTFE. The small amount of interproximal reduction can be done with a polishing strip or a very fine IPR burr. Tooth isolation for Componeer can either be with the split dam technique or with the Optrogate from EverGlow. The next stage would be etching of the tooth, where etching gel is placed on the tooth carefully around the gingival margin. I tend to use a BPE probe. This helps prevent gingival bleeding, which is something we need to avoid. The gel is placed for 15 seconds and then washed the 3-in-1 tip for a following 15 seconds. The universal 1-coat 7 bond is applied to the fit surface of the Componeer with a microbrush and also to the tooth surface. It's then blown dry and then light cured on both the tooth and the Componeer. So we move on to the placement of Componeers. At this point you need to check that your operating light isn't going to be too sensitive to cure the composite that we're going to place. We're going to need some working time, and also you need to put a shield over your loops light. From your kit you're going to need the silicon placement instrument and the silver carving instrument. So the first thing we're going to do is put an adequate layer of the luting dentine composite on the bonded cured fit surface of the Componeer, trying not to incorporate any air bubbles. Also, if we're going to be doing a polychromatic restoration, this is a little bit more technique sensitive. We're going to need to place the different shades of composite at the different levels on the Componeer and gently blend them together. The tooth should be isolated before the bonding with PTFE or the matrix strip. Then we're going to put composite on the prepared and bonded cured tooth surface. We're going to put an adequate amount of luting composite, and again, if we're doing the polychromatic restoration, we're going to put the different types of composite at the different levels and blend them. We must remember that we're trying not to incorporate any air bubbles, as this will show as grey circles under the Componeer, or should I say grey inclusions, and hence the reason why we're going to need some working time for these stages. The Componeer is then placed on the prepared tooth from the cervical aspect and gently pushed into place with the silicon instrument extruding the excess composite. The excess cement is then removed with a silver carving instrument, just gently on the cervical margin and interdentally. Carry on with these two instruments, removing the excess cement and positioning the Componeer until we're happy that the Componeer is in the correct spatial position with the incisal edges lined up and the incisal plane in the right position. When you've checked and you're happy, the Componeer can be light cured into position. I generally do this from the palatal aspect of the Componeer first, and then the buccal aspect of the Componeer. I will add, if you're doing multiple units, it's best initially to do these in groups of 2. This allows you to confirm the Componeers are in the correct position when cleaning the excess composite off and also when light curing. As with porcelain veneers, the excess cement can be removed with red polishing diamonds, being careful not to traumatise the gingival margin. The interproximal surfaces should be finished with polishing discs, diamonds and interproximal polishing strips. The Componeer length and, if necessary, the incisal angle should be adjusted with medium grit polishing discs very carefully. You can also adjust the shape of the incisal angles. It may also be at this stage that you want to replicate wear facets in the incisal edge using the red polishing diamonds and the medium grit polishing discs. Any tertiary anatomical features that you wish to put into the Componeer can also be done at this stage using the microfine red diamonds. I tend to do these in the turbine handpiece, and I'll do these extremely gently, and probably will do these without using any water. Less is more when it comes to doing these, so it's generally a case of doing little bits of them, stopping, polishing, and then maybe having another look. For example, mamelons or pericarmata can be done this way. Next is to polish the areas you've adjusted on the Componeer with the pink and high luster blue silicone polishers, followed by the safeguard discs in the slow speed handpiece. This creates a magnificent luster on the Componeer surface, which is finished off with the silicon carbide brush. Silicon carbides take a bit of time and patience to use, but if used gently and in a circular motion on the Componeer surface, the gloss will eventually show through. It's a bit like polishing an amalgam restoration. You will then find they're great for polishing as a final polishing brush for any composite restoration, and you'll use them in your everyday clinical practice. It's good to show the patient at this stage, and if necessary, you can continue to adjust the Componeer until satisfaction is achieved. As well as pericarmata, mamelons, wear facets and adjustment of shape and angles of the Componeer can be done. Further characterization can be achieved before placement of a Componeer. This can be done by adding calcific marks, mottling, cracked and other discoloration using flowable composites, which are placed and manipulated on the cured bonded fitting surface of the Componeer. This really can produce some spectacular natural results, and you have more control over doing this chairside than asking a laboratory to be involved in the case of trying to do this with porcelain laminate veneers. Componeer has been part of my clinical practice since its launch in 2011. It's been great at providing natural looking restorations to restore anything from a single anterior tooth to multiple units. I found it to perform really well over the years with great patient satisfaction. It's very simple to repair if you find a small chip, which is very rare as it's very resilient and strong and really doesn't stain if it's been finished correctly. The latest version made from the BRILLIANT EverGlow composite is even better. It's cost effective compared to laboratory made indirect restorations, and I have found it to be most useful to treat my more mature patients who have heavily restored, root filled or attritted anterior teeth and request a better smile without having to have expensive laboratory porcelain restorations made. There is a tip I can offer on this point, and analogous to direct multi-layered composite restorations, it's better to replace the old discoloured composite restorations and restore the length of the teeth before placing the final enamel or Componeer layer. There is a learning curve with Componeer. I suggest starting with a simple 1 or 2 unit cases first before attempting multiple unit cases. I also suggest familiarisation by doing the techniques by just doing the upper anterior teeth before attempting lower teeth, taking into account the more difficulties of the incisal relationship of the lower anterior teeth. These are notoriously much more difficult to restore with Componeer. As ever, taking your time, practice the technique, planning and experience are the key for success, particularly with any new technique in dentistry, and I do wish you every success with BRILLIANT Componeer. If you do run into difficulties or require any help or support, please don't hesitate to contact your local COLTENE representative, who will be only too pleased to offer any assistance you may require. I'm also available to offer assistance, and my contact details can be found by contacting COLTENE UK from their office, whose details can be found on the website. Thank you for watching this video. I hope it's been helpful, and once again, good luck.